Continuing on with the nematode lecture, we have Trichuris trichiura and Ascaris lumbricoides for this recording. So starting with Trichuris trichiura, also known as the whipworm. And you can see where it got its name from, because if you imagine these are the adult worms, and it looks like if you were to grab onto the thicker part, that would look exactly like a whip. So this is much like the Enterobius vermicularis life cycle, except for one little exception. So the eggs of Trichuris trichiura are passed in feces, but instead of them being effective almost immediately, because remember, for pinworm, they're infected with just after 4 to 6 hours after passage. These eggs actually have to reach warm, moist soil before they become infective. And this takes about 2 weeks to even a month for them to mature and then become infective. So if you were to ingest the eggs directly upon passage from someone, that would actually be breaking the life cycle because the eggs did not have a chance to get to mature yet. So the eggs have to reach soil, and then humans would ingest the infective egg. So this is your infective stage of Trichuris trichiura. It is the egg after maturing in warm, moist soil. Then, after you ingest an egg, the larva that's developed inside of there will get released, and the larva will mature into adults in the intestines. And because of its whip-like structure, it's actually pointy at the end of it. So it can embed and attach with that spear-like projection into the intestinal mucosa. So why would you ingest eggs that were in soil? Well, this happens very easily in places with poor sanitation and children who have contaminated hands from playing outside. So this is another picture of the adult whipworm. And interestingly, they can live in our intestines for up to 10 years. So you could have these worms inside of you and actually be fairly asymptomatic and be passing eggs and not even know it. Although usually a year is the more common length of time that it inhabits. Eventually it just unattaches and you might just get over it. You know, people might just once you lose all the adults, then you're no longer infected with it either. So symptoms are usually asymptomatic, although a heavy infection, or also known as a heavy worm burden, then the patient will start to exhibit symptoms. So these could be, low levels of bleeding that could result in a hypochromic anemia. Rectal prolapse is when the tissue from the anus, the tissue that lines the rectum, falls out of the anus, and this is more common in children. And then just general intestinal issues of weight loss and diarrhea. It's interesting to note that people often have a double infection with whipworm and Ascaris lumbricoides, which is the next parasite we'll talk about. And this is common because both of these parasitic eggs have to develop in the same type of soil to become infective, and they just inhabit the same regions, the southeastern United States. So it's common to see both whipworm eggs and Ascaris lumbricoides eggs within the same patient. So again, back to how you even get this in the first place. Pica is the condition in which you ingest things of no nutritional value. So people suffering from pica might eat chalk or detergent or strange things, and dirt is one of them. It's called geophagia. So this again can be a result from pica or children who have contaminated, or adults who have contaminated hands, or places where they use human feces for fertilizers on vegetable crops or whatever. This can also result in these parasitic infections. The diagnostic stage of whipworm is the eggs in feces. And this is another one of those very unique looking eggs. Just like I said, when you see a pinworm egg, you know it right away. When you see a whipworm egg, you know it right away. This is described as barrel-shaped or football-shaped. There are two hyaline polar plugs. So you'll notice on each end of the football, there's these little knobs. Those are called the polar plugs. And it's usually a nice golden brown color just because it's taking on the pigment of the stool. It's not necessarily being stained or anything, a particular color. So usually we don't learn colors for parasites in stool because it's not really applicable. So don't necessarily memorize the term brown to describe this egg. And then remember, it's unembryonated when passed. It needs to reach the soil to become infective. Okay, so on to the third parasite, Ascaris lumbricoides. Its common name is large intestinal nematode, and you'll see why in a second. Worldwide, it is the #1 most common intestinal worm, with over 1 billion people affected. And here in the United States, it is the second most common, this says nematode, to be more specific, the second most common helminth infection after pinworm. So of all the worms, pinworm's #1, and then Ascaris lumbricoides is #2. It is transmitted by the fecal-oral route of transmission, just like we've been talking about with Trichuris trichiura. And again, to remind you, there's often a co-infection here with these two parasites. Okay, here's a picture of the adult worm. It is very large. So the males in general tend to be a little bit smaller than the females, but about 30 centimeters is pretty long. It's about the length of 1 foot. So if you can imagine the length of a foot and a whole worm like that in your intestines, and maybe more than one worm, this can be pretty detrimental. So the worms live in the intestines and they feed and they mate there. So here's another good picture of its size, all coiled up. Okay, this life cycle is getting a tad more complex than the ones we've talked about so far. So just like whipworm, the eggs get shed and they're deposited in warm, moist soil, and they need to stay there for 2 weeks to a month to become infective. So just like whipworm in that sense. Now here's where things get a little bit different. So we ingest the infective egg from contaminated food or water. Now there's larvae. The larva has had a chance to mature inside the egg. So in the duodenum or in the small intestine, the larva hatches out of the egg and it leaves the intestinal lumen. It actually gets into the bloodstream. So it burrows through the intestinal wall, gets into the bloodstream, and its first stop is the liver. So it gets into the hepatic circulation. So then it might spend a couple days there. Then it's going to leave the hepatic circulation and travel to the lungs via the bloodstream, and will spend several days in the lungs. Once in the lungs, it's going to break out of the alveoli, get into the bronchi, migrate up the respiratory tree. And what happens is the patient coughs. When the patient coughs, it travels up the pharynx, it hops over the epiglottis and goes down into through the esophagus back into the GI tract. So the patient coughs it up and then swallows this larva. And in this way, it gets back into the intestine, and it's here that the larvae mature into adults. The adults mate, the female lays eggs. And she can lay up to 250,000 eggs per day. Remember, pinworm was like 15,000 eggs a day, and that sounded like a lot. So she can lay up to 250,000 eggs per day. And this whole migration, this is called the liver-lung migration of Ascaris. It can take a couple months for it to do its whole cycle. So here's a good picture. We can talk through this again with pictures. So we've got eggs that were passed in stool. They have to reach soil to mature. Man ingests the infective egg. The egg gets into the small intestines, but remember, the larva hatches out of the egg and gets into the bloodstream. Now, what this picture is not showing is the liver migration. So don't forget about that part. It goes to the liver first, and then it travels to the lungs. So this is all in the bloodstream. In the lungs, it breaks out of the capillaries, and we cough it up and swallow it back down, and here's where the larvae mature into adults. So the symptoms, again, all of these usually depend on the worm burden or the number of worms you have. In general, the more worms you have, the more symptomatic you'll be. However, you can be symptomatic with just one worm inside of you. The liver-lung phase, there's little damage to the liver, but the patient tends to have more symptoms during the lung migration. So this would be chest pain, shortness of breath, wheezing, a dry cough, even a fever at this stage. The intestinal symptoms are just like having any abdominal discomfort, just diarrhea, cramps, achy, even some eosinophilia. But here's where it can get really bad, is when you have so many adult worms that they get all coiled up and they cause an obstruction. And you can imagine how devastating this can be. It can cause bile duct obstruction, gallbladder obstruction, liver, intestinal obstruction. This is when it would get really bad. And the patient doesn't usually die of Ascaris, but if they do, it's because it got to this point and they didn't seek treatment. The adults can be pretty active when they're trying to escape drugs that the physician's administering, or fever will drive the adults to be motile. So it is possible that the patient could have worms coming out of their nose, out of their anus, or out of their mouth. Any openings that the worms are trying to escape from or through. So the diagnostic stage for Ascaris lumbricoides is eggs in feces. And we have a few different forms to learn for Ascaris. It's not just as simple as learning one type of egg, which is on the next slide. Sedimentation is the best concentration technique for recovering Ascaris. Remember, there's flotation and sedimentation. Sedimentation is better here because these eggs tend to be very dense, so very heavy, and they might be missed in flotation because they would sink to the bottom. We have a couple new definition terms here. We've got two descriptors for these eggs. The terms corticated and decorticated refer to a thick, albuminous, mammillated outer coating that the eggs may have. So if they have this, they're called corticated, and if they don't have that outer layer, they're called decorticated. So we can also see fertilized and unfertilized Ascaris eggs in the feces. So to recap, we can see a fertilized corticated egg, a fertilized decorticated egg, and an unfertilized egg in the stool, which is usually corticated. However, there are unfertilized decorticated. So there's really four types. It's just I'm listing the more common ones that we see. The fertile the fertilized egg tends to be more broadly oval, so more round. The infertile egg is more longer and oblong, narrower. These eggs, especially when they're corticated, are resistant to chemicals, and this is what makes them remain infected for years in the soil or water. And remember, they can even survive the 10% formalin fixative that we use in the lab. Okay, so what do they look like? So the top picture is showing, or both of these pictures are showing fertilized eggs. The top one has that thick albuminous layer, so we call it corticated. The bottom one does not. So the bottom one is fertilized decorticated. That albuminous layer makes it look very bumpy. It's very refractal. You'll know it when you see it right away. The infertile egg or unfertilized egg is more oval, long shaped. And it is usually corticated, but here's a good picture of so the top one is unfertilized corticated, the bottom one is unfertilized decorticated. And the inside of it just looks like an amorphous mass of material. You can't really make out anything that's going on inside of it. So this is the end of part 2.